There's a number that, if you ever see it on your blood pressure monitor, means you need to act immediately, not tomorrow, not after breakfast, but right now. Most seniors check their blood pressure, see a high number, feel a little worried, and decide to keep an eye on it. But there's a specific point where high blood pressure stops being something to monitor, and becomes a genuine medical emergency. Today I'm going to give you the exact numbers, the exact symptoms, and the exact steps to take if you or someone you love ever crosses that line. This could be the most important video you watch all year, so please, watch this one all the way through. Important disclaimer before we begin, this video is for education only and isn't a substitute for medical advice. If you are ever experiencing symptoms of a hypertensive emergency, call your local emergency number immediately. Don't wait, don't message a family member first, don't try to drive yourself. Call for emergency help right away. Now, let's walk through exactly what that looks like. Section 1, Normal vs. High vs. Emergency. The numbers. Let's start by understanding the categories, because not all high blood pressure is the same. Normal blood pressure is generally below 120/80. Elevated blood pressure is when your systolic number, the top one, sits between 120 and 129, with your diastolic still below 80. Stage 1 hypertension is 130 to 139 over 80 to 89. Stage 2 hypertension is 140 or higher over 90 or higher. Now here's where it shifts into emergency territory. Hypertensive crisis is when your blood pressure reads 180 or higher over 120 or higher. That number, 180 over 120, is the line. If your monitor ever shows a reading at or above this, here's exactly what cardiologists say to do. There are actually two types of hypertensive crisis, and the difference matters enormously. Hypertensive urgency. Your blood pressure is 180/120 or higher, but you have no symptoms of organ damage. In this case, doctors typically recommend you contact your physician immediately, and they may adjust your medication to bring it down over a few hours, often at home or in an urgent care setting. Hypertensive emergency. Your blood pressure is 180/120 or higher, and you're experiencing symptoms suggesting damage to your organs, your heart, brain, kidneys, or eyes. This is a call emergency services immediately situation. No waiting. No monitoring. Emergency care right away. So the number alone tells you something is seriously wrong. But the symptoms tell you how urgently you need to act. Let's go through those symptoms next. Section 2, the warning symptoms that mean, call for help now. If your blood pressure is extremely high and you notice any of these symptoms, this is a medical emergency. Call emergency services immediately. 1. Severe headache, not your typical tension headache. We're talking about a sudden, intense headache, often described as the worst headache of your life, that comes on quickly. 2. Shortness of breath, difficulty breathing, especially if it comes on suddenly or while you're at rest, can indicate your heart or lungs are struggling under the pressure. 3. Chest pain. Any chest pain combined with high blood pressure readings needs immediate attention. It could indicate strain on the heart or even signal a heart attack in progress. 4. Vision changes. Blurred vision, double vision, or sudden vision loss can mean the blood vessels in your eyes are being damaged by the pressure, a condition called hypertensive retinopathy. 5. Confusion or difficulty speaking. This is one of the most serious signs. Sudden confusion, slurred speech, or trouble finding words can indicate the brain isn't getting proper blood flow. This overlaps directly with stroke symptoms, which we'll cover in detail shortly. 6. Numbness or weakness, especially if it's on just one side of the body, one arm, one leg, one side of the face. This is a classic stroke warning sign and demands immediate emergency care. 7. Nausea or vomiting combined with a severe headache and high blood pressure. This can indicate pressure building dangerously in the brain. 8. Anxiety or a sense of impending doom. This might sound strange, but many people experiencing a hypertensive emergency or heart-related event report an overwhelming, unexplainable feeling that something is seriously wrong. Don't dismiss this feeling. Your body may be picking up on something before your mind fully processes it. 9. Nosebleeds that won't stop. While nosebleeds alone don't always indicate an emergency, a severe, prolonged nosebleed combined with very high blood pressure readings warrants medical attention. If you or someone you love has a blood pressure reading of 180/120 or higher along with any one of these symptoms, this is not a wait and see situation. Call for emergency medical help immediately. Section 3. Why this is especially dangerous after 60. You might wonder, why are we dedicating an entire video to this for our 60+ audience specifically? Here's the answer. As we discussed in earlier videos on this channel, arteries naturally stiffen with age. That means when blood pressure spikes severely, aging arteries have far less flexibility to absorb that force safely. This makes seniors significantly more vulnerable to the organ damage that defines a hypertensive emergency, particularly stroke, because brain blood vessels are especially vulnerable to sudden pressure spikes, and stiffened arteries can't buffer that force. Heart attack and heart failure, because an aging heart muscle already works harder against stiff arteries, and an extreme spike can push it past its limit. Kidney damage, because kidneys rely on consistent, moderate blood flow, and a severe spike can damage the delicate filtering structures inside them. Aortic dissection, a tear in the wall of the aorta, the body's largest blood vessel. This is rare, but extremely high blood pressure significantly raises this risk, and it's life-threatening without immediate treatment. There's also a factor many people don't consider. Seniors are statistically more likely to live alone or have less frequent in-person check-ins. This makes early symptom recognition even more critical because the people around you may not be there to notice subtle changes. This is exactly why I want you to share this video with someone you love over 60. They need to know these signs, and so does anyone who might be with them if it happens. Section 4. Stroke warning signs, the FAST method. Since stroke is one of the most common and dangerous results of a hypertensive emergency, let's go deeper here, because recognizing a stroke within minutes can be the difference between full recovery and permanent disability. Doctors and emergency responders use a simple method to recognize stroke symptoms quickly. It's called FASTF, face drooping. Ask the person to smile. Does one side of the face droop or feel numb? Is the smile uneven? Arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel weak compared to the other? Speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred? Are they using the wrong words? Are they unable to speak at all? Time to call emergency services. If you observe any of these signs, even just one, call emergency services immediately. Note the time symptoms started, because this information is critical for the medical team treating the stroke. I want to emphasize something here. Time is brain tissue. The faster a stroke is treated, the better the chances of recovery. Every minute of delay matters. Don't wait to see if symptoms improve. Don't call a family member first. Call emergency services immediately, then call your family. Other stroke symptoms beyond FAST can include sudden severe headache, sudden vision problems in one or both eyes, sudden dizziness or loss of balance, and sudden confusion. If you live with a spouse, partner, or family member, I encourage you to actually practice the FAST test together right now, today, not when it's an emergency. Knowing it instantly, without having to think, could save a life. Section 5. What to do while waiting for emergency help. Let's say you've called emergency services. What should you do in the minutes while help is on the way? 1. Stay calm and sit or lie down. Find a comfortable position. Many people prefer sitting upright if breathing feels difficult, or lying down with legs slightly elevated if they feel faint. Avoid unnecessary movement. 2. Unlock your door if you're alone. Unlock your front door if you're able to safely do so. This saves critical time for emergency responders. 3. Gather your medication list if you can do so safely without delaying care. Have a list of your current medications ready. This is enormously helpful for emergency medical teams. 4. Do not take extra blood pressure medication on your own. This is important. Taking an extra dose of your blood pressure medication without medical guidance can sometimes cause your pressure to drop too quickly, which creates its own dangerous complications. Let medical professionals manage this. 5. Stay on the phone if you called emergency services yourself. Stay on the line. Dispatchers are trained to guide you through what to do until help arrives. 6. If you're with someone else, stay with them. Keep talking to them. Note any changes in their symptoms, getting worse, staying the same, or improving, because this information helps the medical team understand what's happening. 7. Do not drive yourself to the hospital if you're having symptoms of a hypertensive emergency or stroke. Do not get behind the wheel. Symptoms can worsen suddenly, and you could endanger yourself and others on the road. Always call for emergency transport. Section 6. How to prevent ever reaching this point. Now, the best emergency is the one that never happens. So let's talk briefly about how to reduce your risk of ever reaching a hypertensive crisis. 1. Take your blood pressure medication exactly as prescribed. One of the most common causes of hypertensive crisis is skipping or stopping blood pressure medication suddenly, sometimes because of side effects, cost concerns, or simply forgetting. If a medication isn't working well for you or causes side effects, talk to your doctor about adjusting it. Never stop on your own. 2. Monitor your blood pressure regularly at home. As we covered in previous videos, daily home monitoring helps you and your doctor catch dangerous trends early, long before they become an emergency. 3. Know your personal risk factors. Conditions like kidney disease, diabetes, and a history of heart disease all increase your risk of hypertensive crisis. If you have these conditions, work closely with your doctor on a clear monitoring plan. 4. Manage stress and avoid stimulant. Extreme stress, excessive caffeine, certain illegal substances, and even some over-the-counter decongestants can trigger dangerous blood pressure spikes. Always check with your pharmacist before taking new over-the-counter medications if you have hypertension. 5. Don't skip doctor appointments. Regular check-ins allow your doctor to catch warning trends and adjust treatment before a crisis develops. 6. Keep a written emergency plan. Write down your doctor's contact information, your current medications, your emergency contacts, and keep it somewhere visible, on your refrigerator, by your phone, or in your wallet. In an emergency, this saves precious time. Section 7. A real conversation with your family. I want to leave you with something important. Many seniors don't want to worry their adult children with health concerns. But I'd encourage you to think about this differently. Sharing this information with your family isn't burdening them, it's protecting both of you. Make sure at least one person close to you knows your current blood pressure medications, your typical blood pressure readings, the symptoms we covered today, and what to do if they ever notice these signs in you. This single conversation, maybe 10 minutes over dinner, could be the most valuable health investment you make this year. High blood pressure is manageable. It's treatable. Most of the time, it's something you live with safely for decades with the right care. But today, you learned exactly where the line is, the number, the symptoms, and the action steps that turn a frightening moment into a manageable one. Knowledge like this isn't meant to scare you. It's meant to prepare you, so that if this moment ever comes, you act fast, calm, and confident. If this video gave you value, please subscribe to Healthy After 60, and more importantly, share this specific video with your family. This is the one video that could genuinely change an outcome. Stay safe, stay informed, and I'll see you in the next video.